This is the second part of this ST elevation MI. Now we have seen कि भाई ST elevation MI is very important. So we are talking about ST elevation MI, where we usually find the ST segment elevation. Now we'll be seeing the three different ECGs. We know that mainly the patient may have blockage in left anterior descending artery, or right coronary artery, or left circumflex artery, or the patient may have blockage in left main coronary artery, or there can be also blockage in the posterior descending artery. So what is most important is, if we want to label it as ST elevation MI, we must have elevation of ST, or ST elevation must be there. Now see, uh, when do we label it as ST elevation MI? You must have ST elevation. Now, how much ST elevation you need? You need more than 2 millimeter ST elevation in two consecutive leads. This is very important. There may not there only one lead must not show. It has to be at least two consecutive leads, and there must be two more than 2 millimeter ST elevation in chest leads, or more than 1 millimeter ST elevation in limb leads. Now, which are the chest leads? Chest lead V1, V2, V3, V4, V5, V6. These are all chest leads because we apply the lead on the chest, and that are counted as V1, V2, V3, V4, and V5 and V6. And all the remaining leads are called limb leads. That is lead 1, lead 2, lead 3, lead AVR, lead AVL, and lead AVF. Now, so there must be two consecutive lead involvement, and there must be more than 2 millimeter if it is chest, and more than 1 millimeter if it is limb lead. So what we can see here is lead 2, lead 3, and lead AVF. These are called uh, inferior leads or posterior leads, which are supplied by which territory is supplied by usually the right coronary artery. Now lead 1, AVL, V4 to V6, these are all lateral leads, and which is usually supplied by left circumflex artery. From lead V1 to V4, it is mainly supplied by left anterior descending artery. So this you can remember. Now on this, hence lead 2, 3, AVF, these are called consecutive leads. It is not that lead 1 and 2 are consecutive leads. No. Lead 2, 3, AVF, these are called consecutive leads. Lead 1, AVL, V4, V5, V6, these are called consecutive leads, and uh, these leads V1 to V4, these are called consecutive leads. So when we see in here, we can very easily make out that, for example, this is lead V4, V5. To make you understand, this is P wave, this is initiation, and this is basically baseline. This is basically all baseline because this is traveling flat. So the first wave is P wave, the first negative wave is Q wave, the first positive wave after P is R wave, and the first negative wave after R is S wave. So this is S wave, this is R wave. So here, where is the ST segment is? So this P, this Q, R, this is RS. So this is S point, this is S wave basically, and this is the T wave. So there is more of a ST flattening. The ST segment is flat here. But now see here, in this lead 2, 3, and AVF, we can very nicely make out that the P wave is there, the Q wave is here. Now Q is pretty long because the patient has heart attack. The R wave is there. Now S, now this S has not touched the baseline. The S is far above the T, and there is ST elevation. There is pretty good ST elevation. So we can simply see the baseline is this. This is the baseline. This baseline we have seen here. See, this is the baseline. This is the baseline. Here, the baseline it is pretty above the baseline. So you can see there is one small box and there are two small box, three. So there are total three small box ST elevation. Here also, this is the baseline. This is the baseline, you can see, and this is one small box, this is second small box, this is third small box, this is fourth small box. So there is around four small box XT elevation. Here there is one, two, three. So there are total three small box ST elevation or 3 millimeter ST elevation in lead 2, 3 and AVF. We need more than two consecutive leads. So lead 2 and 3, these are two consecutive leads. It is present in three consecutive leads, and this ST elevation is around 3 to 4 millimeters. So it is significant ST elevation. This is involving 2-3 AVF. So I told this 2-3 AVF is supplied by RCA, usually that is right coronary artery. So this is right coronary artery myocardial infarct. This is inferior wall MI. In this second ECG, we can see that just look at this lead 1 AVL and V4, V5 and V6. So in lead V5, you can see, as you can see here, this is pretty straight. This is pretty straight. But look at here. This is, there is significant ST elevation of one box, two box, three box. So there is 3 millimeter ST elevation in lead 5. Here also, this is the baseline. Here there is one, two, three. There are 3 millimeter ST elevation. In lead V3 there is no very significant ST elevation, but in lead V4, V5 the ST elevation is there. And if you look at here in lead AVL, you can very nicely make out that there is 1, 2, 3. 3 millimeter ST elevation. Look at lead 2. In lead 2 there is no ST elevation at all. In lead 3 there is actually reciprocal ST depression. And in lead 1 there is significant ST elevation of around 1 to 2. So there is ST elevation in lead 1 AVL, V4, V5, and it is pretty minimal in V6, which suggests that there is involvement of the left circumflex artery, lateral circumflex artery. In this third ECG, we can very nicely make out, when you zoom out, that there is significant ST elevation. See, this is the baseline. So this is all baseline. So in this baseline, there is marked ST elevation of 1, 2, 3, 4, 5, 6. 6 millimeter in lead V2, 1, 2, 3. So there is 3 millimeter, 6 millimeter. In lead V4 also, there is extensive ST elevation. So this is basically extensive anterior wall involvement, because lead 1 and AVL, they are not showing significant ST elevation. So in fact, this is anterior wall MI, which is involving this lead 2, 3, 4, 5 and bit of 6. So there is extensive anterior wall MI, which is usually supplied by left anterior descending, or it can be left main coronary artery blockage. So to label it as ST elevation MI, the patient must have chest pain or shortness, or chest pain equivalent like shortness of breath, palpitation, sweating, diaphoresis, weakness that is new onset, and there must be ST elevation present in more than two consecutive leads, and there must be more than 2 millimeter if it is chest lead, and more than 1 millimeter if it is limb lead. So next thing we'll cover in the third part. Thank you.